Well, folks, the session did end, and we've had some time to not think about the legislature. But that time is over. It's time for summer school. We have lots of reading, interim meetings around the corner, and more. Luckily for you, we're here to summarize that. He's Nate, and I'm Andrew. This is the DLC's Policy Corner.
Interim session kicks off this week, and we have a full interim study item list. That's one of the many long documents we've read the past few weeks. We'll have a link on the website, but some things of note include studying special ed funding, Medicaid issues, and behavioral health. Speaking of Health and Human Services interim, we'll get a presentation of another recent audit of the behavioral health system. This time it's bed capacity, and they say a lot of what we've been saying for a while. Until we have a full picture of the needs for beds, we shouldn't be so confident that we need more institutional beds. Hopefully, policymakers listen to the auditors more than they've listened to us.
There isn't much else worth noting this month for interim, but we'll keep you posted on future months. However, as we're talking about behavioral health, one other thing going on this month is Utah Medicaid is renewing their 1115 waiver, which includes expansion. Unfortunately, given some guidance from the feds and changes in H.R. 1, the state is ending targeted adult Medicaid, which allows for 12-month continuous eligibility for the chronically homeless. We're incredibly concerned about this change because it will likely lead to gaps in coverage for this population, including many with behavioral health needs. We'll be submitting comments which we can share on the website, but you can too, before May 21st.
We also read through a long study that we helped get funded a few years ago that tasked the Department of Health and Human Services to do a deep dive into the state's long-term services and support system. We'll also share that on our website, and I promise you, we'll give you that link later. But it's a very comprehensive look at Medicaid home and community-based services, nursing facilities, assisted living, and the DSPD waiting list. There are a lot of recommendations to improve the system, and we'll be talking with the department and legislators about those recommendations.
Relatedly, one of the other things we'll be following over the summer is the federal government's look into Medicaid fraud. Those efforts in other states have focused heavily on home and community-based services, which is concerning. The Center for Medicare and Medicaid Services tasks states with giving information on what they view as high-risk providers, and they will also have to provide a plan on how they will revalidate those providers to prevent Medicaid fraud. While we obviously oppose Medicaid fraud, we will keep an eye on this, as it could have an impact on services in Utah.
All that sounds like we have a busy summer ahead of us, Andrew, but I guess that's job security. As always, you can find all the documents we mentioned and more on our website, disabilitylawcenter.org/issue/public-policy. We'll be back over the course of the summer to let you know what went down and what's coming up. Thanks for watching.